Hi, Beth.
Hi, Molly.
I am so happy that you agreed to take some time out of your life to talk with me.
Oh,
I just so one of the things as we're starting to head back to work, so that the context going into the future, if someone stumbled upon this video somewhere, the context is we've all been locked down in New York State for about 5 weeks with this COVID-19 pandemic. And New York State has started, we have flattened the curve because we've all been so good about staying in place, sheltering in place in our homes. We're not technically in a quarantine unless we know we've been exposed to the disease, but most of us are truly sheltering in place. Like we're trying not to go anywhere or do anything, and have been doing that for at least 4 weeks now.
yeah, I have not worked at the dental office since March 16th.
Yeah, March 13th was my last day working. And Monday morning, that's the 16th, I decided to close my office, and I think it was later that day the governor said, everybody's done. And it was weird how we went from actually having friends at our house Friday night to Monday morning, everybody's got to keep their contact to a minimum. Like just such a short period of time, all of a sudden everything changed.
Yes, like overnight.
Yes, truly overnight. And when I was having conversations, I'm a doula and I'm a craniosacral therapist, which means that unless I'm at a birth, everybody has their clothes on. And so I'm not doing a lot of naked people under sheets work, but when I'm working as a doula, there are naked people and there are body fluids. And so there was a lot of worry in the beginning because of other places in the world where hospital systems got overwhelmed. There were people who needed ordinary medical care who weren't able to get it, particularly pregnant people and birthing people. And what are we going to do to make sure that doesn't happen here? And I think it's great that there was so much compliance that we all like stopped everything so that we could flatten that curve. And so at that point, you work as a dental hygienist. So you literally have your hands in people's mouths.
Yep, sure do.
Yep. So we all stopped doing that work so that not so that we wouldn't get sick. This is an important distinction, right? Not so that people wouldn't get sick. We did it so we could flatten the curve so that if or when people got sick, there would be enough medical services to take care of everybody.
Right. I think we kind of forgot that in the weeks that's just been going on. I think people have kind of forgotten that.
Yeah,
like flatten the curve thing.
Right. I've actually had conversations with a couple of people over the past couple of weeks who have said out loud, they're not going out until there's a cure or a vaccine. And I'm not sure they understand how long that could take.
Yeah.
Right?
Yeah.
Like that could be 6 months. I can't even imagine it happening in 6 months, but it could be 2 years, reasonably speaking. So over time, our culture is going to have to get acclimated to doing some normal things in the midst of a disease that we don't understand all that well and that may have a mortality rate that exceeds the flu. Does that make sense?
Oh, yeah.
Yeah. And so people like you and me, whose livelihood depends on being in close proximity to people, right? Like we can't, someone was talking about the governor of Georgia yesterday announced that he was going to open up all these different services, including hairdressers and massage therapists, but everyone had to maintain social distancing. It's like,
yeah, you can't.
No.
Yeah.
I can't just work on your feet. Like that isn't,
right.
I could, but it's not really what people have in mind, right? Even as a craniosacral therapist, they're going to expect me to actually move up to their head.
Right.
So one of the things that I've been thinking about is, all right, so how do you work in a dental, you work in clinical settings, so you're in a dentist's office.
Yep.
And you're in a nursing home, right? And I have a home office, but my home office isn't off my garage or off my family room. Like, people have to come in my house, go up the stairs, right? So it's not like I've just got people going in a side door. When people come to my office, they come into my home. Which means I have the benefit of small numbers and the negative of they're in my living space. You have the benefit of it's all at work.
Right.
But you have higher numbers of people using like community doors and.
Yes. And the waiting room. I mean,
yes.
On a busy day, there can be 10 people smushed in the waiting room.
Right. So the stuff that I've been listening to in terms of restarting our types of services are, like, you don't have people waiting in the waiting room if you can help it. Wiping down all the surfaces, doing away with paperwork, that kind of stuff. And what we can talk in a minute about not in many minutes, we will talk about the practical pieces. But first, I want us to talk a little bit about how you have done what you do, working so intimately in people's mouths for how many years?
32.
32 years, without succumbing to the fear every flu season that you could kill or be killed by any one of your clients.
Wow. Yeah.
Right?
Yeah, I never thought about it that way, but.
So that's the kind of conversation that I'm hearing in terms of why some of these draconian birthplace protocols have been put in place is every person who comes into the hospital could kill one of the hospital workers. And then the birth people are saying, yeah, but any one of those hospital workers could kill me and my baby. Or it's the daddy saying they could kill my wife or my baby. And so my work is helping them understand that there are ways of minimizing risk and finding a place of safety. Because as you know, with birth, it's about being in your central nervous system safe place.
Yes.
Right?
Yes.
Instead of
right.
There are germs everywhere. They're all gonna
right.
Which, people have gotten sick. So as a care provider, I can't look at them and say, it's not going to happen. Because your nervous system is smart and it knows that there is this possibility that it could happen because it has happened. So we can't pretend that it hasn't happened.
Right.
But there are two reasons why I wanted to talk to you about this and why I think you have pieces that are really helpful to body workers and to doulas. And I know this because you and I have been friends for a very, very long time.
A very long time.
A very long time. And one of the things that I really love about the way that, and why you're my dental hygienist, one of the reasons why I really value what you do is that you give trauma-informed care to all of your dental patients. You're thinking about that as you're working with them, and you're not just trying to clean their teeth. You're a true care provider for them, and you seem to inherently understand that the central nervous system needs to be in a safe, a perception of safety, right? It's not something we think with our brains. It's something that our body perceives, and you have ways in yourself, in the way that you conduct yourself, that help the person in the chair feel as safe as possible, right? Some of us are going to feel more safe than others.
Wow, thank you very much. Something I realized, 1995 was the very first time I ever put together post-traumatic stress disorder and dental care. I was working in a periodontal office, and a woman in the operatory next to me had this horrible flashback. She had been the victim of a violent crime. And this was her first attempt at any kind of, self-care after this. And the hygienist who was working with her was a darling girl doing her best. As soon as she leaned over the woman to begin to treatment, the woman absolutely, flipped out and, made a big scene in the office, and the light went on in my head. I was like, oh my gosh, she's not reacting to the hygienist. She's reacting to the image of someone over her. Oh my God. They are not reacting to me personally.
Right.
They are reacting to what they've been conditioned to expect.
Right.
So so right then I realized, wow, there's something I can do in that.
Mm-hmm.
What I noticed about myself and my fellow hygienists is, we have an expectation of a bad experience with a patient, and lo and behold, we have one. So what I learned to do was to kind of step back from that expectation, the label that I put on that patient, and try and act as if we didn't have that. Because I realized it's me. I'm the one that decides if I'm going to have a good day or a bad day. And if I approach a patient thinking this guy's a jerk, okay, well then, guess what? What are the odds he's going to act like a jerk?
Right.
And I perceive him as a jerk when really the guy's been traumatized. He was I can't tell you the number of patients I've had who were really belligerent in their presenting behavior. As I got to speaking with them, wow, they were traumatized as children. So they're not belligerent as much as they're afraid. And if I can do something to bring that down, I want to do that. And what I have found is if I try to approach every single patient with as neutral and loving attitude as I can muster, then it's just going to go better for everybody.
So I'm trying to remember when you and I went to college together.
Yes,
and
we
then,
did.
Yes, we did. And then you went back to dental hygiene school.
I did.
And put that in the frame. It's not that COVID-19 is the same as HIV, but I think some of the fear in the population is the same. So where were things with HIV/AIDS when you were becoming a hygienist?
So I was working in the dental office in 1985 as the receptionist, doing the office work. I decided to go to hygiene school in 1986. And we were the first class that gloves were required. Prior to that, it was considered a good idea, but wet finger dentistry was the standard. So I remember working on the bloodborne pathogen standard as the receptionist, trying to take all this information from OSHA, and so 85 was when whole bloodborne pathogens, HIV, but hepatitis B has been a problem for dental people for hundreds of years. It's actually a more virulent virus. It's actually harder to kill, but people seem to have, they forgot about it when HIV came along. So when I graduated from hygiene school in 1988, my first year of practice, I had patients who were insulted by my having gloves on.
Oh, because they thought that you were accusing them of not being
Yes. They said, I don't have any diseases. I said, well, maybe I do.
Right, exactly.
Right. Yeah. That, at the same time, so that was at one office, and at the other office, I was working with a practice that was seeing HIV patients from all over the city who'd been abandoned by their doctors. These people called up their dentist office and said, I'm HIV positive, and they said, click. So these people had no dental care. So, we practiced standard precautions. And as far as I know, that was 30 years ago. We never had a case of transmission. I never got HIV from any of my patients.
Mhm.
And as far as I know, we didn't pass it to anybody through the office.
Mhm.
So, I mean, that's why they're called standard precautions. You're supposed to assume that everybody is infected.
Right. What you just said is so important. Even at the beginning of this crisis, the local hospitals were not screening people. They would, if you didn't have symptoms, and this is after we knew that people could be asymptomatic for 2 weeks.
Yeah.
And they were still asking, have you been around anyone? I love this. Anyone diagnosed with the disease when there are no tests. So of course, no one was.
Right. Oh.
Have you had a fever? Are you coughing or sneezing? And then they would let people into the hospital as if I kept saying in these conversations with the hospital professionals, shouldn't we be acting like everybody's got it? Like every person who comes in, every person who's working there, every pregnant lady.
Universal. Yes.
Yes, so I think that's a piece that we need to like hold on to, just what you said. And it's not just COVID-19. It's hepatitis B.
Yeah.
It's hepatitis C. It's all the other things that we carry around in our biome.
Right. SARS, H1N1, any of those respiratory infections, they're all, I mean, we're supposed to be protecting against all of them.
So every year, so you've had this experience of what we're going through right now, of working in an environment where there is a certain stigma around the disease itself. And we don't have the same stigma of only gay guys get this, but there's this real, we don't even know if it's we don't know the real numbers because we haven't been able to test enough people to know what the exposure in the community is. We don't know what the real mortality and morbidity rates are because we just haven't had enough people tested. So right now it looks like this really scary, if I get it, bad things will happen to me disease, right? And I think that's how a lot of people felt about AIDS, certainly about HIV and AIDS back in the 80s, was that, one kiss and you could die kind of a problem, right? But that's the thing. You've learned to work with the HIV population, but also every year we go through, and I'm not saying that this is the same as the flu, but again, all infectious disease is kind of the same place, right? So every year we go through flu season, and again, you're in the nursing home working on, and in your office too, but you're working with fragile populations.
Right.
So how do you manage that? How do you work with that idea that of being exposed to or exposing someone else to the flu every year during flu season?
It is really interesting. Well, at the nursing home, I get it. You have to have a flu shot every year. If you don't get a flu shot, you have to wear a mask. So I always get the flu shot. I always just figure I got it. I do the best I can. Practice universal precautions, and take as good care of myself as I can in terms of with my own immune system. We all have. You have to have a susceptible host. Okay, so we're all exposed to this virus all the time. What happens is your immune system, you have to kind of catch it on an off day, and that's when you quote unquote get sick. These pathogens are coming in all the time. A lot of people are getting sick because they don't breathe through their nose. They're breathing through their mouth. You have the best HEPA filter ever right here. And people aren't using their noses to breathe, so therefore they're breathing in air that's not filtered. So that's been my my mantra is I do the best I can with what I know, and And, I leave the rest to, God, the universe. The best thing I can do for anybody is for me to be calm.
Yeah, and that piece, I think I need to be generous with myself and with my other care providers, that if we're feeling some anxiety because this is a new thing, like flu, this is what's so weird for me. I have never been afraid of an illness before. Anything, nothing. It's like, I do my best. I wash my hands. I take care of myself. I clean my place. I observe universal precautions. I do those things. And then, like you said, I can't control everything. And I'm very careful not to work if I don't feel well. I tell my clients they can cancel at the last minute if they've got a fever or they're not feeling well. All of those things I already have in place. But there's something about the way we don't really understand how this disease is transmitted yet, and we are only now starting after the respiratory professionals are only now starting to understand what's helpful treatment. Like they're thinking that maybe the ventilators, although that is really well intentioned and sometimes is a good thing, but maybe more traditional respiratory therapy might actually be better. Which, wow,
who knew, right?
But they're literally learning as they go, right? We are all learning as we go. So one of the interesting conversations amongst the professionals, and this is true for doulas too, is when we talk about essential and non-essential services, it's very easy to get into this existential conversation about, is it worth dying over, right?
Right.
And yeah, exactly. And so I'm trying to remember the exact words. Choosing between safety and respectful treatment. Like, these don't have to be opposing forces. Right. These can be things that we agree upon together in a good informed consent situation.
Absolutely. Right? They're not mutually exclusive.
Right. Well, sometimes when we're trying to be extra superhuman, I guess, we start to talk in terms of the only way I could possibly provide treatment in my room, and these are the kinds of things people are talking about, is to strip it of everything so that in between clients, I can literally wipe down every single surface that might have a droplet on it, and then bring my client into that, wipe down my stairs and all the doors and everything. And I'm not saying that's a bad thing, but that's what that does, is it removes some of the other things that my clients find settling to their central nervous system. So we're making these trade-offs between what allows my client to feel like they're in my office doing the things they do with me versus being somewhere else. And for the kind of work that I do, those intangible things can be really important. So I hate the idea of just throwing all that stuff away, because they're part of what creates the safety. Am I making sense?
I think you're speaking about the things that are in your office that you don't want people to walk into just a bare room.
Yes. Yeah.
Well, what I was thinking, so 35 years ago, wet finger dentistry was the standard. Nothing was separated or bagged. Everything was in drawers. Even surgical stuff, they didn't get bagged. So It's not that long ago that, and there was no infection control, really. Doctors used the same cup all day to clean their mirrors. The assistant would pour a cup of mirror dip in the morning, and the doctor would use it all day long.
Wow.
Yeah. And, and in between patients, you would have a pile of papers on your tray, and you would take off the top paper.
I remember that. I do remember.
Oh my God.
Yeah.
And there's, dentistry is surprisingly bloody. I don't think people realize how much blood people deal with on a daily basis. So if I'm cleaning someone's teeth and I'm putting up my instruments up on this tray, and I just take off the top tray, that blood is soaked through like 4 or 5 layers. It's like, ew. So, I would like to refresh people's memories as to the very sorry state of infection control in the dental profession not that long ago. And dentists were complaining about it. Oh my God, I can't feel anything with these gloves on. Oh my God, it's so expensive. So, it's not that long ago that this whole idea was like, they're trying to make us like an emergent, like a surgery room, like we're a hospital or something. I'm like, so there's a happy medium.
Yes.
There's a happy medium. In surgery, in a hospital, in a surgical suite, yes, you have to have sterility. In a dental office, you cannot have sterility. It's physically not possible. So what I'm hearing and reading now, when you were talking about, having a bare room, that's actually not a bad idea in a dental office because of aerosols. Especially when you're working with a handpiece or an ultrasonic scaler that's projecting these pathogens out into the air. It's better to have less for them to land on. So, in your case, I don't see why. Of course, I'm not Anthony Fauci or whoever, but I don't see why you would have to, go to all those lengths. I know for me, when I think about going back to work, I'm gonna have to do that. I'm going to have to put everything off the counters, and that means like over here in the corner, there's brochures. I have this little stuffed animal. It's all got to go. And I also can't use the ultrasonic scaler. But we know that that this pandemic is there's less people potentially carrying it because I don't want to create aerosols. I was also thinking I'm going to get really, we should all be wearing high neck coverage, long sleeved to and below the knee. And very few dental offices really enforce that. So I'm gonna order myself some long lab coats, enough so that I can wear a new one every day, and then come home and wash them in hot water and bleach. And it needs to stay in the room. Like I don't wear it out. I'm probably take it off in between patients when I walk them out. But try to contain as much as possible. Right.
One of the people that I was listening to, they were even talking about people like me changing clothes in between clients.
Oh, for Christ's sakes.
And so here's, to come back to this part, I could feel the anxiety just going.
Yeah, jeez.
That there has, like you said, there has to be a happy medium between trying to keep every single speck off of us and maintaining this sense of we live in harmony with microbes. Right? That we have to find a balance with this microbe, and that, yes, just like flu season every year, people will die and people will get sick, and some people won't get anything at all, and there's no rhyme or reason to it, and it's not right or wrong, that some of this will happen. And I think the question that I was wondering about from your standpoint, because of the work that you you do helping people stay calm in the midst of, see, that's the thing. I don't have body fluids unless I'm in the hospital. When I'm in
Right.
the hospital, I can't speak to that. I am smart in that I do wear gloves. I've always worn gloves as soon as blood started being evident and I knew I needed to touch like a bare leg. I would put gloves on because I know to do that, right? I think now we're probably going to start putting in, when we're allowed back in the hospital again, who knows when that'll be, but we'll start putting on some PPE of some sort, because we want to have a mask on. But in my office, unless I'm actually doing mouth work where I'm putting a gloved hand inside a person's mouth, and even then, nothing's spraying, right?
Right,
like,
you're not really creating an aerosol.
No. So everything is very contained and very safe. And I think that if I needed to have a little more safety, because when I'm working on someone's head, maybe I would put a mask on and have a mask on them. If I wasn't working in their mouth. I mean, these are things I can negotiate with my clients in terms of their degree of safety, or they'll be mandated and I will follow whatever the guidance is, right? Like that makes it easy. But I think you talked about this, but I just want you to say again how you keep your countenance. Let's say someone walks in your office and they're sniffly. This is the time of year too, like starting around Memorial Day to the 4th of July, I am a sneezing, polleny, allergic spewer. I'm not sick, but I'm spewing. So when someone like that walks into your office, how do you calm yourself down?
You know what? It just, even with the COVID stuff, I would certainly ask them, before I open the door to the waiting room, no matter who is on my schedule, I always, say a quick serenity prayer. God, grant me the serenity and let me approach this person as, openly as I can. And sometimes it's hard because these are people I've seen before and it's like, this guy. And that's what I try to do in general. COVID, if somebody came in with an upper respiratory issue, I would probably want to take their temperature and ask them, whatever do you have trouble breathing? Have you been exposed? And, talk about whether or not they want to be seen that day. Or I want to see them that day.
Right.
For me, I always assume that I'm protected. I am never afraid of getting anything from a patient. I'm just not. I know that, I'm doing the best I can with personal protective equipment. I have a good immune system. And so that it's really interesting. It really just doesn't occur to me to be afraid. And, I've had patients, poor people, like before standard precautions, anybody that admitted that they had some sort of, hepatitis B, oh my God, they would isolate the room and they, when I was in dental hygiene school, the whole, in front of the whole clinic, you parade this person in, the whole unit's covered in foil and, it's like,
oh no.
Yeah, I'm like, let's just really shame this person for having a bloodborne disease. So I'm really grateful for the whole institution of standard precautions because it's a lot safer. It's a lot kinder.
Yes. Yeah. I think that's one of the parts that's hard right now is that, again, in the birth world, if you get admitted into the hospital, and I don't even know if this is true right now, a month ago, a couple went into a hospital in Buffalo, and the partner, the dad.
Oh, that was a big deal.
The baby. No, this was different.
Oh, different.
Yeah, this is different. Yeah, that was here in Rochester, but we won't even go there.
Okay.
But this family, the dad had a job where someone, and back then, like the number of COVID people that we knew about was in like on one hand, two hands, somewhere in there, very, very small. And the couple was asked if they had been around anyone who had been diagnosed with COVID-19, and he properly disclosed that yes, this person had passed through his place of employment at some point. He wasn't sure if he was even in the building when it happened.
Mm-hmm.
They took the mom, they took him, they put her in isolation, they put him in a suit, all the people who took care of her in a suit. They threatened to remove the baby as soon as the baby was born, to keep the baby in isolation for 2 weeks, not because they knew that there was COVID, but because of, and this, I mean, what a difference a month makes, really.
Right, right.
This is before the World Health Organization's suggestions came back that the mother could choose to keep the baby with her. All of that stuff hadn't happened yet. And these people were literally terrorized under the objective of the care providers saying, we can't afford to get sick.
Right.
And we can't let you get sick and get the baby sick. So we're going to do all of these Herculean things because we don't understand. We don't understand, really, right? So while we're still in this, we don't understand, there is a lot of fear. And that is what I have to keep reminding myself, is that in terms of myself as the care provider, my chance of staying healthy is directly dependent upon my ability to be able to say, I have done all I can do. I have impeccable self-care. I have created whatever it's going to look like.
Right.
Not changing anything until I open again. So right now I still have all my goodies. But whatever my new space looks like, I have prepared, right? I have prepared the space. I have prepared myself. I'm going to do a lot of educating of my clients about what the new protocols will be. And there probably will be some screening questions like, have you done any traveling? Have you been exposed to anybody? Have you had a fever? How are you feeling? Upper respiratory and the rest of you. And then we both get to decide, right? Like we both get to decide whether this is an appropriate day for this to happen. And all of us in our calendars who see people in this way are going to have an impact for a long time on our schedule, right? Like be prepared to have half your day disappear because they might have it.
Well, you have situations too where patients come in, a patient, I can't tell you how many times this happened. Somebody had a knee replacement and they come in and, oh yeah, I had my knee replaced. Well, did you take your
Right, yeah.
Nobody said anything about a pre-medication. You call the doctor and the doctor says, oh yes. And then, so I have to tell Mr. Jones, I'm sorry. Then they get really mad. And then the doctor's mad because they're losing the production and everybody's mad. So, and, in a few situations, I've, seen patients, I've been bullied into seeing patients that I really shouldn't have seen. And, but there's also been times where, I have stood my ground, and guess what? We all survived. But, that right there it's very uncomfortable. It's very uncomfortable. So if a patient comes in and, it's going to happen. Somebody's going to come in. They're going to have an upper respiratory infection. And I'm going to say, if I take their temperature, your temperature is like 90, it's 100. And I'm going to have to say, I don't think you should be seen today. And there's going to be a problem. People are going to be unhappy.
Right.
And that's like my worst nightmare come true, is like, oh yeah, somebody's not happy with me. I'm in trouble.
Oh, Beth, I don't know. I don't have any idea what that is.
I don't know what you're talking about. So, and it's what's not constructive is obsessing about that now, and thinking about and trying to jump out. See, here's my strategy. Think of all the possible things that could go wrong, and then jump out in front of it and control it. So, which is, it's just ridiculous.
Right.
And so the living, that whole serenity piece of trying to, go with the flow, live and let live, and accept things as they come has helped me a lot. And just the day-to-day grind of dealing with people.
Yeah.
And especially in a dental office, people are, the vast majority of people in a dental setting are not in a good place. Their primitive brain is way up here. So I have to take that into account.
Yeah, they're already not happy to be there.
Right.
Yeah.
Vast majority of people. Very few people are super happy to walk into a dental office.
The one time that I encounter that, well, actually, I guess there are two situations where I encounter that. One is when people have been injured in a motor vehicle accident, a car crash, that, like I shouldn't have to be here. My body shouldn't be broken.
Yeah.
There's that. And then the other piece is fertility challenge.
Oh yeah, how heartbreaking that's got to be.
Yeah. So the person having the fertility challenge is often really resentful that they need to do all these extra things,
and defensive.
Right. Well, not even defensive so much as already in not a good nervous system.
Yeah.
And so the piece that I miss, and knowing you the way I do, I'm sure that you miss some of this too, is because we practice the way we do, and we both have this central nervous system settling focus in our work, I miss the in-person part of that. Like, there are a lot of things that we can do over, virtually. I can give a lot of information, and I can actually be very encouraging, but humans have central nervous systems that don't just respond to facial expression and tone of voice. They respond to what our body is doing, and like pheromones that are coming off of it, things that we don't fully understand, right?
Oh, absolutely.
That help to create that feeling of, oh, I can settle in and relax here. And that's what I notice happens with those clients. The first time they come to see me, they're like, but after that, they've been given something that's helped them, and they've been greeted in such a way that I'm like, hey, I'm okay with you feeling like that. And I know you are like that too. You're like, I recognize you got dental trauma in there.
Right. Yeah.
Right.
You're fearful, presenting as hostile, fearful, presenting as, unfortunately, one positive interaction with me generally does not do a whole lot. And the next time they come, a lot of times it's as if
it never happened.
So, and I have to realize that and keep my expectations low, because I've done that where I'm like, gosh, geez, the last time you were here, and again, that's me and my expectations, create, working to create a situation that can only go spiral downwards.
Yeah. But that's even if you have to start from negative whatever each time to bring the person into a more settled state. That settled state, if the pathogen is in the room, if I'm settled and they're settled, the chances of that turning into a disease state is much lower.
I agree.
I believe everything that I know about the immune system would lead me to believe that it's not as simple as, if I feel comfortable, I don't have to do all the other things. No, I do all the other things as part of creating that sense of safety. And then, like you said, a key part of my job is to determine, can I maintain that sense of safety? And if I can't, my job is to say, no, I can't see you today, whether it's because the person has a fever or they're coughing or there's some other my antennae are going off for so
That's
much.
right. Your intuition.
Right. Yeah. And I think because a lot of us don't have the financial resources to say, well, I'm just not going to do this anymore.
Right.
Right. I'm leaving.
Mhm.
No, I love my work and I need a job. I've got to make money doing something.
A lot of hygienists are, this has been going around and around on the different forums that I'm in. Are you considering quitting dental hygiene?
Mm-hmm. Mm-hmm.
Yeah.
Mm-hmm. Yeah. But I wonder if we went back 30 years to the HIV/AIDS epidemic, were there similar conversations? I don't know, because I wasn't doing this kind of thing back then.
I'm sure there were, because 30 years ago, there were people like me who'd been doing it, doing dentistry, been in the dentistry field for 20, 30 years.
Mm-hmm.
And at that time, I mean, that whole bloodborne pathogen, that was as brand new to them back then and frightening as this is to us now.
Right, right.
Even more so back then because we really didn't know.
Yeah, yeah, yeah. I have to confess to a secret fun thing that I've been doing. One of the teachers that I have taught with a lot in the past, Marjorie Chisari, who's in Saratoga Springs, and she and I would teach biodynamic craniosacral therapy together. Her son, Michael Minna, is an immunologist. I hope I'm saying the right thing. He's either an immunologist or a virologist at Harvard. Gosh. And so he has a Twitter feed. And so I'm following
absolutely
all of these virology and epidemiology and immunology people, and I don't understand half of what they say, but they're having, along with so many other healthcare providers, this little celebrity moment because they know the things that we need to understand in order to interact with the general public and figure out, even for ourselves, one speaking of the central nervous system. So you and I, we live in Rochester, New York, and Rochester is the home of Wegmans. And Wegmans for me has always been my safe place. Like when I didn't live here, I missed Wegmans. And when I moved back here to get married and have my family, one of the happiest things was I got to go to Wegmans again. I'll tell you, going to Wegmans is very stressful, and it's one of the things that makes me most distressed about the change. Is that Wegmans is no longer my happy place. Wegmans is the place where people are all worried about being near each other. It's such a shift from what I'm used to. And I have to remind myself that I don't have to be anxious because I'm in Wegmans. I've got a mask on. I know how to wash my hands. It's not that big a deal. But the general environment is such that there's so much more fear happening. Again, I'm not used to it. This is not how I am accustomed to functioning. I'm used to being like, hey, germs, no big deal. They're all around us. We can live with them. So this is a new thing for me to even have it be something that I'm thinking about.
Part of my whole personal improvement over many, many years has been to reduce my reaction. For so many years I was a reactor, and I really thought that I was being authentic whenever I reacted to everything with all this emotion, and I was expressing myself. And what not realizing that no, you're not. So responding and not, there's a difference between respond and react and respond. And over many years, I've learned how to respond and not just react. So that, that's priceless. I cannot put a price tag on that.
No, and it's when I'm teaching, particularly the biodynamic work in Upledger, the opportunity to talk about this doesn't come up as often. But one of the things I love about craniosacral therapy is that my job is to do exactly that.
Mm-hmm.
To be present and not react, to respond to what I'm noticing in my client, or to, if they have feelings come up, to be present, to hold space for them, but also to not react to whatever starts going on in my own head, right?
Mm-hmm.
So fortunately, over the years, I've developed the ability to pause, observe without judgment,
Mm-hmm.
and then respond, as opposed to, like you said, I'm exhibiting my Italian passion.
Right, that's right. I am right, you know. And
I'm reacting to you.
right. And that knee jerk, it was genuine news to me to be informed that my opinion is a fact. I'm like, what? I just thought it was the truth. So, you know, but that's, you know, and that's that chain of observe, label, react. It was and I just thought I was just being right. I was just being real.
Yeah.
And who knew? I didn't know that. Be informed that, Beth, you're not always right, but yes, I am.
And this is a real, I think, in terms of being present in person with people who need help, who also, like in your case, and in my case, people who haven't stopped needing the help for the past month, right? Like,
Mm-hmm.
they're starting to pile up a little bit, and
Right.
and whether you're talking about cavities or a root canal, or, you know, like whatever it is that people need.
Yes.
I have some people who, if they don't see me on a regular basis, some of them, their mental health suffers. I mean,
Mm-hmm.
I have these little babies that I do work on inside their mouths that helps them feed better.
Right.
And I'm not trying to stand up and say, hey, I'm an essential worker, but there is starting to be a little pressure. Like,
Mm-hmm.
I need to find that middle ground. I need to find a place where I feel at peace offering what I have and what people need,
Mm-hmm.
and not be terrified when they walk in the door.
Mm-hmm.
And coming into that place of, I don't have to know everything, right? I don't have to
Mm-hmm.
figure it all out. I
Right.
just have to do what I'm told. If I am told, do what I'm told to do, and then prepare my space as well as I can, prepare my inner space
Right.
as well as I can. And that's it. I find, I'm really not being facetious with this. There are healthcare providers who've been working intimately with body fluids their entire careers, and they have not gotten sick.
Right.
Right? Like, that's not new.
Right.
So,
you know, if you look at the statistics of all the healthcare workers right now who are treating all these COVID people, not a lot of them are getting sick from it. I'm aware of.
well,
So,
and the ones who are, they're not being given appropriate personal protection equipment.
yeah.
That's a place where we, as a government, a society, I'm not sure where in there, we're not operating with all our tools.
Right.
I have the luxury of, I won't open until I feel I have the tools I need, right?
Mm-hmm.
Like, I'm not, my husband is still working. My livelihood, my roof over my head, and food in my belly does not depend on me getting my clients in as fast as I can. So I can wait until I have masks that are appropriate for this. You know, I can wait until someone tells me, are my homemade masks good enough? Do I give one to a client? You know, I can get all those questions answered, and then create that safe space for myself. I don't have to feel like I'm cutting corners, whereas the people in the hospitals.
Right, people in the hospitals. Yeah, when you're working in somebody else's space, like, you know, most hygienists work in a dental office, And if
Right.
you are working with a doctor who is, wants to have good infection control and all that stuff, that's great. But if you're working in an office that's run by a dentist who's not more concerned with seeing a lot of patients,
Production.
that production and cost saving, and that puts the hygienist in an ethical quandary that is exhausting. I just read an article about that, about it's not so much burnout as it is being forced day in and day out to go again, that cognitive dissonance of every day in and day out being doing something that you shouldn't be doing, and being expected to do something that you shouldn't be doing.
Well, and that's another important thing moving forward too, is like you said before, listening to the intuition, listening to that voice. You and I, this is something I speak a lot about when I'm talking about reproductive and social justice. The role of the woman to make everything nice and make compromises, even when it's woman to woman. We often get caught tying ourselves into pretzels, trying to make things that we know are not okay.
Yeah.
And that does really bad things to our immune system.
It absolutely does.
Right? Yeah.
I
Especially
agree.
those of us who are of a certain age.
Right.
So, yeah. So because there's a concept in the Black healthcare policy called weathering, and the toll it takes on your body to deal with racism every day.
Right.
It has this weathering effect on Black people because they're constantly feeling that stress in their bodies.
Absolutely.
And I don't know what that word is for women, but we also experience that constant misogyny that comes with us.
Right.
It takes its toll. And one of the things that I'm hoping will come out of this, a number of our national and statewide leaders are talking about, how can we use this pause to create new visions that are better for everybody, new ways of doing things. Like you said with the dentist, they once they put the gloves on, they did not take the gloves off. Right. So what will be the things that we carry forward that are lemonade? I'm all about the lemonade, right? The lemon, what can we do about the lemon? But there's always lemonade to be made. So that's kind of where my focus is.
That's why I love you, because that is you. That is you in a nutshell, about the lemonade. Oh my God, I love you.
Yeah, I'm all about the lemonade. So that's what I'm hoping, and I'm so grateful, and always have been, that you have brought the same desire to bring I call them clients in my office, your patients that is in your chair, not to a perfect place of, ooh, but can you get them one notch below where they were when they came in?
Oh, right? And you know what? And I'm so blessed. I am able to accomplish that the vast majority of the time.
Yeah, and you've worked hard at it.
Yeah, and patients. Oh my God, Beth! It feels like I'm in a spa. Beth, you're so nice. I feel so relaxed. Gee, wow. No.
So you have a website.
Yes, I do.
It's
Surdentity.
Surdentity.
Surdentity. Surdentity.com, and a Facebook page, Surdentity. Oh, and that's my book. Look, here's my book.
There it is. We had the book launch party at our old studio.
That's right. Oh my gosh, that was a great day.
It was a beautiful day. And that really, I think having that attitude as we move forward into greeting our clients, patients, with this idea that we're all in this together, they have something they need something that I have. We're going to find a way to come together and do it in a way where we all feel safe. And we didn't get into this too much, but encountering the existential angst of what all of this is pointing out, which is that human beings all go through the dying process at some point. I don't want to be the one who provokes that.
Oh, right.
Right?
Right.
But you know, when you and I talked before, I think you brought up a really good point that this kind of puts it in our face and makes us anxious and super controlly because we you know, wait a minute, people do die.
Yes, they do.
They do. And holding that inside ourselves with, yes, they do. You work in a
I had a wonderful experience with a dear friend, spiritual advisor of mine, and we were going through, I was talking about a relationship, and, you know, if it didn't go the way I wanted it, and, you know, and I was mad about it. So he's saying, so I say the first, you know, well, if he doesn't love me, then whatever. Then what? And he kept saying, and then what? Well, and this. And then what? Well, then that. And then finally, after about the fourth one, I was getting real mad. I was like, look, if this doesn't happen, I'm going to die, okay? I'm going to die. And he goes, okay. And when you die, who are you with? And I was like, I'll be with God. He said, yes. Yes. And I can't even tell you how, wow, I mean, getting choked up right now thinking about it. What a revelation that was to me. Like, that's really what I'm afraid of. And if I can just keep telling myself, I don't have to be afraid. That to me is priceless.
It is priceless. And that's it. You work in a nursing home 1 day a week?
1 day a week, yep.
Yeah, and I worked for 5 years in the at Strong Memorial Hospital with the palliative care team. So I worked with people who needed help with chronic pain and getting more comfortable with their active treatment, but I also worked with hospices under palliative care. So I also worked with patients and their families who were in the hospice area. And I have to say it was tremendously helpful for me to spend some time with people who were actively in the dying process.
Oh, it's sacred. It's sacred. I hate to sound like a weirdo, but you know, when a patient at the nursing home that I was close with, when I was informed that, you know, they were dying, I would go up to see them and just, you know, put my hand on them just to, you know, comfort them, because to me, yeah, that's absolutely sacred.
So it's not something, you know, like you said, when we take it past the, but then, when we can get to the place where, oh,
yes,
that, and we have that as practitioners, when we have that in ourselves, then when the client comes in and they're genuinely having some fear around, I have been in my house for how many weeks and now I'm in your house.
Right.
You know, like, okay, I can feel that and I can be okay with it. I can just witness that and allow you to have your feelings and show you that my nervous system is really okay. That, right? I think that we can give that to our people that we're, again, you are, when you're working, you're
right, like right in their face.
And I'm right up in people's business holding, you know, I got a sticker in one hand and their back in the other. I'm not far away from them. So I do feel like humans need, we can't all just decide forever for the rest of human civilization we're going to stay 6 feet apart from each other. Like, that's not work.
No, it's not. That's not how we're built.
No,
it's not how humans are wired.
No, it's not. So I am so grateful. I'm so grateful for you just because you're you, but I'm also grateful that you were willing to spend this time with me. And I just love it whenever you and I can nerd out professionally. That makes me really
Yes.
happy. Yeah, thank you. Thank you so much.
You
sweetheart.
are entirely welcome. Who knew? Who would have thought, 30 whatever years ago at Fredonia State, that we'd be, that this is where we'd be, but
We'd have this conversation.
I know, it's awesome.